Hello, everyone. My name is John Sadowski. I'm the president of Metro Valley Advertising, and welcome to another episode of the Personal Injury Marketing Newsletter. This week, we're talking with Allison Muller, the principal owner of Acri Muller Consulting. Allison, why don't you please say hello to everybody?
Well, thank you for having me on your program, John. I'm Allison Muller. I'm a toxicologist outside of Philadelphia, and I want to also welcome you to today's podcast.
Thank you. And why don't you explain a little bit more about what it is that you do, Allison, as a toxicologist and some of your background and history?
I'd be happy to. So, I am a clinical toxicologist, meaning the focus of my career in toxicology is on the assessment, care, and treatment of poison patients. So, there's different types of toxicologists. Some types of toxicologists focus on research, or they focus on laboratory science or reproductive effects of toxins. But as a clinical toxicologist, my focus is on patients. So, with that, the bulk of my career in toxicology was nearly 2 decades at the Poison Control Center at Children's Hospital Philadelphia. During my long tenure there, I was consulted on patients that were potentially poisoned from 21 counties here in Pennsylvania and the 3 counties, the entire state of Delaware. And so the poison control centers are ahead of their time in terms of they've been doing teleconsults since the beginning.
Mm.
So I would get a call that would be escalated to me from the poison control hotline staff, usually staffed by nurses or registered pharmacists or both, as in the case of our center in Philadelphia. And if they needed to escalate a case to a toxicologist because of the complexity of the case or a specific request from the healthcare provider, and I was on call, I would then speak to the healthcare provider about how to assess that poison patient, how to treat them, things to look for, potential antidotes, how long to monitor and how, etc. So, following that portion of my career in toxicology, I was a medical director for a medical education company here in Philadelphia. I traveled all over the country, joining key thought leaders in really educating those about new drugs. And of course, as you would imagine, as a toxicologist, the aspects of adverse effects, meaning the bad things that the drugs may do, and how to monitor and treat for them. My company, I'm a company of one, was launched in 2014. We just had our 10-year anniversary, Acri Muller Consulting. And so I combine the experience of those two roles that I've had as a toxicologist. So I do medical education and medical writing for not only physicians, but pharmacists as well. And then I also act in the capacity of an expert witness in cases that involve drugs, alcohol, environmental toxins like carbon monoxide,
Mm.
medications, and part of that also involves teaching attorneys the science of toxicology.
Mm. Wow. Okay. That's a lot. So can you kind of help us here and explain how that experience in toxicology really intersects with legal cases, um, and particularly for personal injury cases?
I would say it's the exception, not the rule, that attorneys who contact me would have any medical or scientific background. So that being said, when they have a case that involves, a drug or alcohol or environmental toxin, they really, struggle to understand the science of the case. So, of course, if they need someone to, give an opinion and testify as to the opinion regarding that particular drug or toxin, they're going to need an expert witness. But there's things that they need to understand even before they're involved with an expert witness. What's the viability of this case? What's the role of the drug in this case? Does that hurt my case? Does it help my case? And so, because I have spent my entire career teaching in one way or another, whether it be on faculty at the University of Pennsylvania. I'm a professor there. I teach pharmacology, toxicology, or doing continuing education programs for physicians or pharmacists. I see my role as an expert witness as that of a teacher as well. So teaching the attorneys the science of their case and ultimately the trier of fact, the judge and the juries. And so one of the things that I think personal injury attorneys may struggle with is really understanding the science of their case, and they're not expected to, right? They're an expert in the law, whereas then they have experts, like me, a toxicologist, or other scientific or medical experts that can take it a step further. One of the things I do, because I am really passionate about teaching and I really want to educate attorneys even before they may work with me as an expert witness, is I teach CLEs, so continuing legal education programs nationwide, virtually for the most part, but certainly I love to do them in person as well. Really, and personal injury attorneys often do attend these programs because they want to understand what's the role of alcohol in my case? How do I interpret a drug test result? What can those tests tell me? What can they not tell me? What kind of things are challenging when you have a situation where someone has died and you have drug testing results that are done along with autopsies. So all those things to say that personal injury attorneys are no strangers to these types of cases and certainly need to know the science for their cases.
So when you're talking to a PI attorney and you have some of these complex toxicological issues, how do you go about helping that attorney understand that and deal with that and decide what to do with it?
Well, when I first meet an attorney, which is our initial phone call, whether they've reached out to me by email or if they've gotten on the phone with me initially to say, hey, I have this case, and they're not looking for an opinion, nor should they be, nor are they getting one, right? There's no such thing as like an instant opinion. That would be fairly reckless of me to say, oh, here's my opinion on the case after talking to you for 15 minutes. But I can at least tell them, hey, this is in my wheelhouse or it's not in my wheelhouse. And if it's not in my wheelhouse, if I know another person with expertise that could help them, I'm happy to provide that referral information. But one of the things that the attorneys will also chat with me about on the initial call would be, this is the information that I have for the case. And sometimes I can tell just from talking to them in that brief time, you don't really have a lot to go on, or that's not going to be something that I'm going to be able to give you opinion on if we don't have XYZ and you can't get XYZ, that sort of thing. And so sometimes that helps the attorney right there, especially if it's a personal injury attorney, thinking, I don't know if I'm going to put all that time, money, and effort into this case if, this expert is saying, it doesn't sound like I really have a lot to go on, or I really don't have a lot of information. And attorneys appreciate that candor. I mean, they may hang up the phone and say, boy, that Dr. Muller, that was great that she was honest with me and upfront and said, you don't really have a lot going on there. Or, she really helped to say, I need to dig further. And, maybe we end up working together on a case.
Dealing with it, I guess, from the personal injury attorney side of it, how do you help now if you're actually in court when you have to take these complex issues and explain them to the lay people of the jury?
I mean, I have a lot of experience explaining very complex concepts and situations to, let's say, patients or parents of young children or older adults in my time at the Poison Control Center. So I did spend a good amount of time speaking with patients and families when I first got to the Poison Control Center, and I have to explain, okay, this is what we're concerned about because your child swallowed gasoline. This is what could happen. This is why we're watching for this or that. And this is why maybe the child needs to go to the emergency department and be monitored. And on top of it, these people are very nervous, very scared. They need to make sure that they have knowledge. Knowledge is power, to understand. They're still going to be scared because this is their child or this is their loved one that's potentially poisoned and could have something serious happen to them. But at the same time, you can't be using all this complex medical jargon because it's going to go in one ear, out the other. So we say, in terms of whether we're making written educational materials for families, or we're talking to families about toxicology related issues, we keep it around a sixth grade level. And that's not saying that attorneys need to be spoken to in a sixth grade level like the general public would. However, what I'm saying is I'm used to using plain language when it comes to explaining very complex concepts, because they have to be able to understand. So, you have members of the jury that there's a range in terms of educational backgrounds, specialties, professions, everything, right, from A to Z. So you have to be able to explain as an expert witness at their level what they can understand and paint a picture for them. And so my role as an expert witness toxicologist is to educate. And if I'm not able to educate and help the triers of fact understand the science of the case, I'm not doing a very good job, because that's what I am there for. That's what any expert witness is there for, because we have specialized knowledge that is key for the jury understanding the facts of a case. We need to be able to impart that knowledge in a way that's easy to understand.
Gotcha. So I guess since you're all your experience working with kids and explaining things to children, if you can make it understandable for them, then you can do it for a jury as well.
And not so much children, but the parents, right? I
Yeah.
mean, like anybody who's a parent, there's got to be some situation where you were really scared that something was either wrong with your child was sick, or maybe your child swallowed things. I mean, my children, when they were little, they weren't highly exploratory. There's some, we say like 2-year-olds were our best customers because they're in that exploratory phase of picking things up the floor, putting it in their mouth, or going into grandma's purse looking for candy, ends up getting pills, and it's really scary to have that situation. So, having all that practice really, lends itself to being able to explain things in plain language. You
Mm.
could have the most knowledgeable expert, most well credentialed expert in the world, but if they can't speak the language that the jury can understand, they're not going to be an effective expert witness. And again, they're there to teach. I'm there to teach. I've had the occasional attorney ask me, "Oh, how many cases have you won, Dr. Muller?" I said, "I've never won a case." "You haven't?" "No, I've never lost a case either." Because I'm not an attorney, right? I'm not there to win the case, lose the case. I didn't go to law school. I don't have that skill set. But the skill set that I do have is in the realm of toxicology and being able to explain how that it relates to the case.
Gotcha. So how do you decide to work with an attorney on a case? How does that come about?
I mean, it's certainly somewhat mutual, but I'm vetting them and they're vetting me. I mean, we kind of have to have that, same philosophy. We kind of have to have that same chemistry in terms of how we see the role of an expert witness. I mean, there's
Mm.
certainly, rules in terms of expert witness testimony. But in terms of philosophies about expert witness, I just gave you part of the philosophy that, hey, I'm not there to win the case. If
Right.
you're hiring me as an expert to win the case for you, then I'm not your expert, and my feelings won't be hurt. I'm just gonna, go to the next person and you find a different expert, because I also am there not to only tell you good news. I'm there to tell it like I see it. So, if I have an attorney that says, um, I have this case, and I've literally had this happen, and the attorney will say, "I want you to report, and this is what I want you to say in it." I said, "Well, I don't know, number one, if I'm going to have an opinion. If I don't have an opinion, I'm not going to write a report, and I'll let you know what the contents of the report would be." So if they're like highly directive, that's not how I work as an expert witness. And so that's not a good fit for me. Or
Mm.
if it's an attorney that, is somebody who's like, "Oh, a diamond was made under pressure. I love last minute things." I don't do last minute cases. I literally had an attorney call me. It was the holiday week, right around the Christmas holiday, and he had a jury trial. I think it was like December 23rd. Court was still in session, and he called me on like the 21st. He's like, "Can you review this case and be there for trial?" Don't work like that. I hope you find somebody. So, it might have been the most interesting case in the world. Actually, it was quite an interesting case, but I don't work like that. I want to make sure that we have ample time to let everything marinate, to discuss the case, for me to thoroughly review all the records. It would be even better if I was involved early in the case and we can talk about deposition questions for upcoming depositions. and maybe additional records that would be helpful for me to form an opinion. So those are things that I'm looking for when I work with attorneys. An attorney that is, under the realization that, hey, my opinion is my opinion and is not to be influenced by what you want the case to be. An attorney that's not afraid to hear bad news. I have attorneys that tell me, yeah, that's just as helpful, because if you tell me, these are the weaknesses of my case, that's super helpful, because I'd rather hear it now than hear it, when, we're up at the jury trial.
Yeah, that makes sense. So talk to me a little bit about your process that you go through from the time you initially consult with an attorney to trial.
So after the initial call, I kind of get a lay of the land of the case and make sure I don't have a conflict, because it might have been a case that I've already heard about, or I've worked with that company before or something. So I'd say, okay, if I don't have a conflict and this is a case that's in my wheelhouse, then I'll send the attorney a copy of my CV and my professional services agreement. And I don't start work on the case until I'm retained, and attorneys all get how that works, right? If anybody, use an attorney themselves, whether they're attorney or not, they're not doing any work on the case until they get the retainer and the signed agreement. So then that's the green light to start working on the case. And then the records come in, and I tell the attorneys I work with, send me everything you've got, because I don't know what to ask for if I don't know what you have. And I'm not going to waste my time or your money or your client's money, belaboring over records that are not going to be helpful for me. But, you'd be surprised sometimes that records that don't really sound like they're going to be interesting for a toxicologist can be really helpful for me. So send me everything you have. And also this way, there's no, surprises, and there's no like, oh, you cherry picked. No, I had everything and I was able to go through it. So once I review all the records of the case, I do not put pen to paper. I do not start writing a report. I don't do any of that until I have a conversation with the attorney about my opinion of the case. And so that might be by phone call, or it might be, by Zoom or similar. And I tell them what my opinion of the case is. And depending if my opinion is favorable to the case, then depending on the state, I may be writing a report, or I may go straight to deposition or straight to trial, depending on where this attorney is practicing. And the attorney's the one who calls that.
Gotcha.
And then from that point, decide if it's going to be something that I'm going to continue working on. The case may settle. It's a little bit different ending to everything.
Gotcha. Okay. So changing gears a little bit, you mentioned earlier that you love to teach. Can you tell us about some of the continuing ed programs that you run that might be of interest to personal injury attorneys?
Yeah, so I teach, there's 7 different topics. I mean, I didn't create 7 topics in the course of a year. It was over several years. And the way that I created the topics for these 1-hour CLE programs was just, I would make mental notes and physical notes of questions that came up time and time again from attorneys, and definitely from personal injury attorneys, about cases. And then I thought, if I can teach these concepts to the attorneys, they've already got a leg up on the cases in terms of understanding the science. So it just so happens that the first 1-hour CLE talk that I put together and presented really was something that was most helpful for personal injury attorneys. And it goes by different names depending on what the slant of the topic would be, but it might be Toxicology Pearls or Toxicology 101. I call it the bread and butter talk that I do for attorneys. And it covers topics that would be of interest to personal injury attorneys. Things like drug testing results. I mean, that's going to be helpful for a lot of different specialties for lawyers, but especially personal injury attorneys. And I can think of just several personal injury cases where understanding what the drug levels or the drug testing results mean, or what they don't mean, really are paramount to the case and how the attorney is ultimately going to approach the case. Some other topics include one program that I present called Medication Misadventures. And it could be for a personal injury attorney, a plaintiff's attorney, could be for a defense attorney. These are interchangeable in terms of they all want to understand the science of the case. They're just hoping for a different outcome, right? So this one program called Medication Misadventures kind of focuses on like 10 tips when reviewing cases that may or may not have involved a medication that caused harm to a patient. And I say may or may not because that's what you're assessing, right? You want to know if you're a personal injury attorney, could this medication have been involved? And it's a case that maybe is not out and out about a medication. If you're a personal injury attorney and you're reviewing medical records and a patient is on medications, don't just keep reading on because, oh, this isn't about medication. This is about the surgery that they had that maybe didn't go right. When this talk that I give gives you things to think about when you see medications in the medical records. Maybe there's drug interactions that nobody's really thinking about, or drugs that were given to a patient that probably wouldn't have been the best because of medical conditions they have or their age. Or maybe it's you seeing antidotes that have been used in a medical record. You need to ask yourself and get very curious, why did they use this antidote? Was there something bad that happened, or would they just have it by the bedside in case something bad happened? And then I'll just mention a third topic instead of all 7 of them. But a third topic that I present on is postmortem toxicology for attorneys. So for those of you who are personal injury attorneys and the injury has resulted in death, if there's postmortem toxicology testing done, this helps you understand the challenges that are associated with interpreting postmortem toxicology testing results.
Interesting. Okay. Sounds like there's plenty for them to keep up with their CLE credits in the cases of toxicology. So can you share an example of, when toxicology has played a major role in a personal injury case that you've been involved with?
Sure. And, this is just off the top of my head. And this is also going to vary from state to state. Like there's some states where it doesn't really matter if there was like a defect in the roof, the sidewalk, the whatever, then it doesn't matter if the person was, impaired or high at
Sure.
the time. And sometimes it does. So, but those are things that toxicologists can get involved in, right? That's for the legal experts to know. But it tends to be same song, different verse. And by that, I mean, something bad happens. So somebody falls through a roof, falls through an elevator shaft, trips on the sidewalk, gets hit by a car. Those all sound cut and dried, right? Let's look at the roof. Let's look at the sidewalk. Let's look at the other driver. Let's look at this, right? But then you get toxicology results and, ooh, they had cocaine, they had marijuana, they had amphetamines, like, pick your poison type thing. What did that mean for that person trying to fix the roof, trying to cross the street, trying to walk on the sidewalk, trying to fix the elevator shaft, trying to fix the plumbing, or, on some piece of a construction equipment? What did that mean? Because especially if it's a plaintiff's attorney, they don't want to be blindsided by the defense saying, well, your client was high at the time, that's why they fell, tripped, died, etc., right? You need to make sure that you understand that, what that means for your case. Sometimes it's not able to be determined. Well, I can think of many examples where they only have what we call preliminary toxicology results, toxicology screens. Those are not the end all be all. All those say is, well, we found something that looks like, let's say, an amphetamine, so it registered positive, but that doesn't mean there was an amphetamine. And that's certainly not going to tell us if the person was impaired because of this drug test result. There needs to be more information to kind of tie all that together. But, a jury hears that if, the attorneys don't understand, like, hey, that's something that can be not only problematic for our case, but really is just preliminary and should be excluded. The jury hears that, like, oh, he was high. I get it now. You know what I mean? Like, you want to make sure that everything's clear. And again, both sides, plaintiff and defense, they both want the same thing, other than like they both want to win the case, but they both want the same thing as far as I'm concerned. They both want to understand the science. They're just hoping for a different outcome. And that's what my allegiance is to the triers of fact, for them to understand the science of the case.
So what advice would you offer to personal injury attorneys when dealing with an expert witness in the field of toxicology?
Well, first, I would say when it's time to share the records, share everything. I know you're thinking, oh boy, this toxicologist, wants cell phone records, wants, Facebook posts. Believe me, that's helped me. I'd say more with my criminal cases. But you know what? Don't cherry pick documents. It's not going to help anybody because you don't want to be blindsided. You don't want your expert to be blindsided. Share everything you've got with your retained expert. And also, don't be afraid to hear bad news. I mean, I'm not afraid to give it. Don't be afraid to hear it. If I say, looking like your client was impaired at the time of this incident, and that's my opinion. That's not the opinion you want to hear, but that's the opinion you need to hear because you'd rather hear it from me before you continue on with the case and possibly even go to trial. And the other thing is to work with experts that you actually like and trust, right? If you don't like or trust your expert, it's not going to go well. And I don't mean, oh, I like how she talks. But do you think that your expert explains things adequately? Do you think that you both have the same working style? Is you're the expert the type of person that, I'll call you in a few days, I have a lot of other cases, or you have very good kind of communication patterns and styles? I mean, the attorneys that I work with, they'll always say, oh, I can't believe you called me right back. Well, first of all, I don't want to forget. But second of all, I kind of think, hey, if I call you, I hope that I can get a call right back too, like, once you're back from court or whatever, because I'm not calling to see how you're doing, although of course I care, but I'm not calling to see how you're doing. I'm calling for something important for your case.
Yep. Makes sense. Makes sense. So anything else you want to relay here in closing?
Well, I would say if any attorneys are interested even in attending one of my CLEs or some of the groups that I've done CLEs for, say, hey, if you want to give your, attorneys that you're in contact with a link to this program, we'll give them like a free CLE credit. I don't know how easy it is to come by free CLE credits nowadays, but I know I still have to do CLE credits as a pharmacist. It's becoming increasingly harder to get free CEs as opposed to when I started in the early 90s. Like everything was free for CEs. I'd be happy to do that. So you can not only get a free CE credit, but learn some toxicology and kind of hear, hey, how does Dr. Muller present and how does she explain complex toxicology topics, and also give you a break from Netflix. So
There you
that's it.
go.
Netflix, but an hour talk on toxicology, after work, as opposed to watching the latest series, might be refreshing.
And you'll understand the series even better after the CLE credits.
That's right. If you're a true crime or one of the
Yeah.
forensic file people, yeah.
Super. Well, Allison, I'm going to put all of that information in the closing slate so that people have time to get that, and including the link to your classes. I want to thank you again for your time and expertise here today.
Well, thank you, John, for your time. It was a pleasure, and I appreciate you thought of me.
My pleasure. Thanks.
All right, John, take care.
Bye bye.